We're very happy to have Dr. Soumya Swaminathan with us, Assistant Director General and Chief Scientist as well of the World Health Organization. So with no further ado, Dr. Soumya, the floor is yours.
Thank you very much, Jan, and good morning, good afternoon, and good evening, I guess, to most of our participants. And thanks very much also to Kaveh for those introductory remarks and for really having set the scene for the discussion today. So I'm the Chief Scientist at the World Health Organization, and one of the departments within the Science Division is the Digital Health and Innovation Department, which has really taken the lead, working with staff across WHO departments, but also with partners outside, many partners. Many of you have been involved in developing these guidelines. And I just want to say a few words about what it is and how we think it can be used. So on the 27th of August, we published a guidance document for countries and implementing partners on the technical requirements for a digital vaccination certificate. Of course, all of us are much more today in the digital world than we were 20 months ago. And it has its advantages. So a vaccination card or a certificate, which, you know, in most of our countries is still a paper record. And we know the challenges and difficulties of paper record, particularly for poor people and for others who don't have a stable home. There's every likelihood that this will be lost. And as more and more people in our region are moving, have mobile phones, have connectivity, it makes a lot of sense to think about these kind of documents which people can have as a digital record, perhaps in addition to a paper record, or perhaps as a replacement. So the idea really is for these technical standards to provide interoperable digital solutions by setting minimum standards for what the certificate should have and also the core data that needs to be used. And this is what I think Kaveh is referring to, the fact that if every country went about doing it in their own way and designing their own software and platform, interoperability could be a real challenge. And the certificate of COVID vaccination likely will have to have some kind of global interoperability. So as I mentioned, the guidance was developed by staff, and Garrett Mel from the DHI department is going to make a presentation, but with a number of multidisciplinary experts around the world, because we want it to be useful for governments and implementing partners. It's part of a series of planned documents. So as you know, in many countries, in addition to a vaccination certificate, RT-PCR test for COVID-19 is often also done as a requirement for travel. And in some countries, proof of having had COVID infection is also good enough for up to 6 months as proof of some kind of immunity. So there will be specification standards related to those certificates, that is for the lab test results and the history of previous infection, which will be published, I hope, by the end of October 2021, so that all of these, you know, can be really used as a package. Is that the WHO is, while we are developing these digital technical standards, because of the reasons that we've already discussed, and countries are likely to use them to make some sort of rules and regulations around travel. We do have the international health regulations where the emergency committee needs to update them from time to time. And WHO is very clear that proof of vaccination should not be used as a condition for travel. And while proof of vaccination can be used actually to relax some of the requirements, like around quarantine, etc., because of the inequities in vaccine distribution, both between countries and within countries, we're not at a point where every human being on this planet has equal access to a vaccine. So it would be very unfair to base travel policies on the fact that somebody has been vaccinated or not. So just to keep that at the back of our minds as we're talking about the ease of doing our work on a day-to-day basis, the ease of using a digital platform. We're not talking here about the ethical aspects, which will into play if countries start implementing, rules. And the other thing that WHO has clearly asked member states is to recognize all vaccines that have received WHO emergency use listing. This again will make it easier for global travel, because at the moment we find different countries recognizing different sets of vaccines. And this is causing a lot of challenges for students, for business people who want to travel across borders. So this is again a request from WHO to recognize vaccines that have received the stamp of approval from WHO, because we don't do that unless we're confident on the efficacy, safety, and manufacturing standards. And then finally, on the international health regulation, the yellow card, which is the international certificate for vaccination, that is the only one that, the only disease for which it's currently used is yellow fever. I think the time has come to move towards a digital version of the yellow card, and our colleagues in the emergency department are working along with us to make that happen. But we needed to start with something. So the first thing out is the digital certificate for vaccination. Coming next will be the recovery certificate and the lab certificates for testing. And then following that, hopefully the digitized yellow card will follow as well. So thank you very much, Jan, and back to you to go ahead with the rest of the program.
Okay, thank you very much. And thank you very much for making this point about the ethics of the digital COVID certificate. I think it's very important to make this point that the digital COVID certificate is not to be a barrier to entry to a country. It's actually just to facilitate further, right? And so that we all have to keep this very much in mind. So thank you again for this.